Welcome, Dr. Tilak.
Hello, Dr. Ajay. Hello, Dr. Jyoti. Hello, sir. Hi, Niti.
Hello, Dr. Tilak.
Good afternoon.
So we are waiting for Rajiv to join.
We're just waiting for Dr. Lata Bhatt to join. She is joined as delegate, trying to shift her to the panelist panel. Mrs. Sushil, can you promote Dr. Lata Bhatt?
Okay, sir.
Welcome, Dr. Puneet.
Good afternoon.
I think when we can start, be promoting Dr.
Yes. Good afternoon, Dr. Jyoti.
Good afternoon. Good afternoon.
Hello, Dr.
Welcome,
Niti.
Hi, good afternoon, everybody.
Hello, Dr. Lata. Hello,
Hello.
Dr. Puneet.
Good afternoon. How are you, Dr. Kaval?
All good.
Good afternoon, ma'am. Good afternoon, Dr.
Good afternoon.
Multani.
Good afternoon.
Hello, sir.
Good afternoon, all the respected faculty and our dear delegates. Today we are here how to decode Mchat. They're simple 20 questions which parents need to answer in yes or no form. But sometimes their perception of the Mchat questions in the Mchat is quite different from what we think. So if the parent has answered some question as yes or no, we need to go through it whether parent has marked it right or as per her or his perception. So that's why I have kept this session so that if there's any issues with the children, they can be detected at any early age, and so that the appropriate therapy can be instituted. So we have esteemed faculty with us today, and I request Dr. Niti Agarwal to please start the program. Dr. Niti? I think she is traveling, but anyway, we have esteemed faculty. Mainly, we have Dr. Kowaljit Singh, sir. He is the chairperson elect of the national chapter of the IAP neurodevelopmental chapter. We have Dr. Shambhavi Seth. She is the national honorary secretary of IAP chapter of neurodevelopmental pediatrics. We have Dr. Lata Bhatt, ma'am. She is the treasurer of the national chapter of neurodevelopmental chapter. And we have Dr.
I'm the joint secretary, not the treasurer.
And we also have Dr. Praveen Suman. She is the Delhi coordinator of the neurodevelopmental chapter. We also welcome Dr. Mukesh Dhankar, sir. He is the secretary IIP Delhi. We welcome him and request him to say a few words.
Sir, I'm not that wise to say about Mchat, but yes, it's a delight to be a part of this. I would be really eager to learn more about it from you and Dr. Parveen Suman. Thank you very much.
I request Dr. Punish Sharma to request Dr. Kavalji, sir, to start the presentation.
Yes. Good afternoon, everyone. Dr. Multani, as we know that he has been very well known teacher, and he has been teaching us a lot of about developmental pediatrics. So I request sir to please start his lecture. Over to Dr. Multani, sir.
Thank you, Dr. Puneet, sir. And at the outset, good afternoon, everyone. I thank IAP Delhi and IAP East Delhi branch, and especially Dr. A.K. Gupta, sir, for making this program For last few years, it has been going on, and I think what IIP Best has done is that they have made Autism Awareness Day into an Autism Awareness Month. So it is very heartening to see that a lot of efforts everybody is putting, and I'm sure as we all are facing this rising demand of increasing autism prevalence, but with sustained efforts and with efforts from everyone, we'll definitely be able to diagnose this better early, and then definitely these children will have a much better outcome. Dr. Gupta, can I request you to share my slides, please?
Yes, sir, please go ahead.
Because I had requested Dr. A.K. Gupta to share my slides. So, well, as you all know, autism is a neurobehavioral disorder which presents in the first few years of life as the child develops. And with age, as the requirements of from the child increase, the child is not able to meet them. So it's a disorder of early childhood development. And for last 2 years, with the IIP President Dr. Piyush Gupta sir's early childhood development program that was going on, the focus has been on early childhood development. And in this early childhood development, there is a specific part which covers for autism screening. Can we have the next slide, please, sir? Dr. Gupta, can I have the next slide, please? Yeah. So, as per the DSM-5, which is the Diagnostic and Statistics Manual of version 5 of 2013, autism is a spectrum disorder. So, spectrum is there's a whole range which is there, and there are two simple things. One is a defect in the social communication and interaction, and the other is a restricted repetitive interest and sensory motor behaviors. So combination of these results in what we call today these days as autism spectrum disorder. Yeah, next slide, please. So as a child is developing, in addition to the child's physical growth, we also have to look at the mental development of the child, which for which there are many screens which are there. So like for a general development, we have something called ages and stages questionnaire. We have our own Trivandrum developmental screening chart. So many screening tools are there. So similarly for autism, we have a simple, very simple tool which was mentioned by Dr. A.K. Gupta, Dr. Puneet, Dr. Dhankar. That is Mchat. It's a very simple tool. It's a parent-based questionnaire. Mchat stands for Modified Checklist for Autism in Toddlers. So which can be very easily done, not just by doctors, even by the parents. So we'll just try to unravel the whole thing as we go ahead. And along with my fellow panelists, we will just try to unravel the whole thing that these 20 questions are very simple. And what does this MCHAT RF means? Next slide, please. Dr. Gupta, can we have the next slide, please? Am I audible? Hello.
Yeah, Dr.
Dr.
Kawal,
Ajay, unmute yourself. Dr. Ajay, unmute कर लो जरा.
Yeah. Dr. AK, can you please go to the next slide? Hello. So this is a very simple
Next
screening
slide,
tool.
next slide.
And yeah, next slide, please. So like the heading itself says modified checklist for autism. So that means there was some earlier checklist. So earlier there was a 23 questions checklist which was there, which was modified way back in 2009, and they made it more simple so that it's easier for people to use. So with this new checklist, there are only 20 questions which are left, which are there to be seen. So it's a very handy tool. It's a parent-based questionnaire of 20 items. And there are another 20 questions which are just the same question. They are also there and they are meant for the follow-up interview. What is this follow-up? I'll come to this as we move further in the presentation. This particular questionnaire is validated for children between 16 to 30 months of age. And this questionnaire is available in many languages other than English also on the website mchat.org. So anybody who wants to have this questionnaire in Hindi or any other regional Indian language, they can go to this particular site www.mchat.org and download. It's a freely downloadable questionnaire that is there. Now, the best thing is, since it's a screening tool, this we should understand that this is a screening tool. This is not a diagnosing tool. So, and it has got quite high sensitivity and specificity. The initial scoring, which is there with Mchat, that has got a 91% specificity and a 96% specificity. And if used correctly with the follow-up questionnaire, the specificity touches almost 99%. And not just that, this particular questionnaire, if found positive, definitely tells us that there is some issue with the child's development. That means there is some sort of developmental delay that is happening in the child, and there is a urgent need for detailed evaluation as well as intervention, early intervention in the form of a developmental support and guidance.
I'm so sorry, वो थोड़ा कंप्यूटर में कुछ प्रॉब्लम हो गया।
Okay,
सर आपके
no
पास स्लाइड्स
problem. Can we have the slides, Dr. Gupta?
हैं?
Because I won't be able to share from my end at this place. Or can I share if you give me some? I don't know how to share my screen.
Sir, just press the green button. Mr. Sushil, please make me co-host.
Hello, is my screen visible?
No, sir, not right.
Not yet. Let me try again. I'll try again.
I'll send the slides to Mr. Sushil. Mr. Sushil?
So there's some issue. Dr. Shambhavi, can I share my slides with you and then you can share from your end?
Yeah,
Is it
yeah,
okay?
you can mail me the slides. I can share.
1 second, I'll just share the slides to you. Thank you so much. I'm just mailing it to you. Yeah, I've shared my slides with you. I think I'll request Dr. Gupta to allow Dr. Shambhavi to share the slides.
Mr. Sushil? Sushil?
I have still not received the mail, Dr. Kaval. If you can just check it has it gone?
Can you check now, Dr. Shambhavi? Just now it has
Yeah,
shown me that.
just got it. Just got it.
Yeah, right. Okay. Thank you. Sorry for the inconvenience. Sorry, extreme. Are the slides opening, Dr. Shambhavi?
Yeah, I'm just opening. Just give me a few seconds. Yeah, I can open it. I'll just do a screen share. Can you see the screen?
Yeah,
Yes, it's visible.
thank you. Can you just make it full screen?
Yeah.
Right. Yeah, so we'll continue from here. Like it's a two-stage screening tool because it mentions Mchat R-F. R-F is it revised with follow-up. And like I told everybody that it is a screening tool which is validated for children between 16 months to 30 months of age and is available in many languages at this particular website. Next slide, please. And studies have shown that it's a very sensitive as well as specific test, which if used properly, will pick up many cases which are likely to be autism spectrum disorder or some other developmental delay who will require some intervention for development. Next slide, please. So this is how it looks. Don't get worried by the cluttered slide because this is how the questionnaire is for Mchat, which is a simple 20-point questions with simple yes and no answers. So this is the first part which I told you, which is the Mchat revised. And next slide, please. So what we have done as advised by Dr. Gupta that we have divided this program into uh, four different parts. So five questions each one of us will be dealing so that it becomes easier for everybody to understand. So these are the first five questions of the Mchat revised format, which have a very simple yes and no answer. And the questions are very simple. If you point at something across the room, does your child look at it? Yes or no? And there is a small hint or example also for the parents. The second question is, have you ever wondered if your child might be deaf? Yes or no? And does your child pretend, play, or make believe? Yes or no? Does your child like climbing on things? Yes or no? Does your child make unusual finger movements near his or her eyes? Yes or no? Next slide, please. Now, once this parent has completed the 20 questions, so based on scoring, which will be dealt at a later date, there's a simple score. Most of the questions will have yes as the normal answer, except for question number 2, 5, and 12. This again, as we are discussing the questions, we'll be dealing with, and each wrong answer gets 1 point. So once you total the score of a child after completing the questionnaire, if the child scores less than 2, the risk of autism or developmental delay is very low and it's considered a good score. A score higher than 8 or equal to 8 is a very high score, very significant, and justifies urgent referral for the child for not just detailed evaluation, but also for a good hearing vision screening as well as starting early intervention. The gray area is in between these two. That means somebody who fails 3 to 7 questions. What needs to be done for this? So for this, that is what I was saying, that there is a follow-up interview that needs to be done for these children. Next slide, please. So the follow-up interview also has the same now questions. Only thing is they have, in place of a yes or no, they have a pass or fail. Now here it becomes slightly different compared to the previous questionnaire. And how to do this follow-up, I will be coming after this slide. Go to the previous slide, Dr. Shambhavi. So this, no, the previous one. This one, yeah. No, the next one, the one after this. Yeah, this one. This one, sorry. So like we said, stage 1, most of the children will be in the green zone. They will be having less than 2 score. That means they are normal. A significant number of children may fall in this yellow zone of 3 to 7 fails. So they require this follow-up interview. And in this follow-up interview, if they have more than 2 fails, then again they need to be evaluated. So this is how it becomes very significant. Now we'll come to the next part of this presentation for these first 5 questions, that how you get this information, because many times parents are not very clear about how to tell. So we will discuss each question in detail in this revised follow-up. So if you see all these questions, each question is given a flowchart about how to make this child pass or fail based on these detailed questions. So first one is, if you pointed something across the room, does your child look at it? So if the answer by parents is no, then you have to give them some examples. So like there are examples for pass and examples for fail. Like if the child looks at, you point at some object, does the child look at the object or point to the object, or looks and comments on the object, or looks at the parent, if points and says look. So these are pass examples. And similarly, there are fail examples also, like child does not look at the parent, ignores, looks around here and there, or maybe looks at parent's finger but not the object. So these are fail examples. At the same time, if still parents are very confused, like they say that at times child is doing what on the something on the pass side, something on the fail side. So you have to categorize that which one is more, and based on which, whether you have more passes or more fails, accordingly, you make the child pass or fail in this particular question. Next slide, please. Now the next question is on, have you ever thought that your child is deaf? So now again here, it's a very simple question, but you will find that a child who is around 18 months or so, for whom we are doing this particular questionnaire and parents are not very clear. So then you have to ask you whether he ignores sounds or whether he ignores people. So if the answer, previous slide, please. Yeah. So if the answer is no to both, then the child passes. And if the answer is yes to either, then the child fails. At the same time, since it's a follow-up, you have to ask whether the child's hearing has been tested or not. And if the hearing has not been tested, then this child needs to undergo a hearing screening test, right? Next slide. Yeah. Now, next very important thing, that does this child pretend, play, or make believe? That means he has got that much imagination that he uses the day-to-day items which are there in the household and plays around with them as if he's doing a real life work with that. So now these are the so many options that are given to the parents to see whether the child, like whether the child drinks from a cup, the child plays with the spoon or a fork, or the child talks on a telephone or a dummy telephone, or he tries to feed a doll or animal with real or imaginary food, or he plays with a toy car or a toy plane, or does he try to cook something on a pretend stove, or tries to cook something, or similarly he tries to do something some household work which he's seen his mother or father doing, but in a dummy way. If the answer to any of these questions, any of is yes, then the child passes this particular question. If the answer is no to all this, no to all the questions, then the child fails in this particular question, and then we label this as fail. Next slide, please. Now, next is, does the child like climbing on things? So answer can be yes or no, and what the child enjoys climbing can be stairs, chairs, furniture, or playground equipment. If the answer to any of these questions is yes, then the child passes this particular question, and if the answer is no to all the questions, then the child fails this question. Next slide, please. This is a tricky question because many times parents are not able to understand that does the child make any unusual finger movements near his or her eyes. So now this is one of the trick questions I told you, in which the normal child will have no as an answer. So if the child answer is no, then the child passes. But if the answer parents are giving as yes, then you have to go more into detail. And there are some examples which are given for pass and some examples which are given for fail. Like for the examples which are given for pass, does the child look at his or her hands or moves fingers while playing peekaboo? If the answer is yes to these, then the child is pass. And fail examples are if the child wiggles his or her fingers very close to the eyes, or keeps the hands very close up to the eyes, or to the side of the eyes, or if the child flaps the hands near the face, or if any other unusual movement, if they can make a video of the child doing that particular movement, which you can see, then if the answer is no to all these, then the child is passed. Otherwise, if the child is doing any of these fail movements and they are happening more than twice a week, then the child fails this particular question. So this is the fifth question which is there. This is how we go about doing the Mchat revise and Mchat for follow-up. So this is my share. I'll request Dr. Shambhavi to take over from here for the next 5 set of questions. In case there are any questions, I can take them now or later.
Thank you, sir, for a wonderful presentation. I'm sorry for the technical glitch, but we'll take the questions together after all the questions are done.
Right. Thank you, Dr.
Thank you, Dr. Kanwal, for setting the background to Mchat. I hope my slides are visible to everyone.
Yes, ma'am.
Okay.
Can you make them full screen, ma'am?
So this is actually a
Okay.
I think PDF of
It's
this. So
It's visible nicely.
right. So thank you, IIP East Delhi, for this effort and involving the chapter for this program. And as a lot of pediatricians who are referring to us now, children are already doing Mchat. I think it's just a very good idea to revise it and understand what are the kind of gaps which we can see in our clinical practice, though the Mchat has been done, but it may be wrongly marked. So many times when we just leave it to the parents to mark, they may not understand the question fully. And we as pediatricians can do a lot of observations when we are interviewing the family or the child for a brief, maybe for the vaccination or a health check also, and understand whether this thing is right or not, what correct or not, what they have marked. So the questions which were given to me are from 6 to 10. And like Dr. Kanwal had mentioned about the Mchat RF, so the revised follow-up version has a detailed elaboration of each question. And it's a very good tool if you can just go through it and understand what exactly this question means. So I will just be sharing the revised version of this, the RF version, where the detailing of each question is done. So when we start with question number 6, which is, does your child point with one finger to ask for something or to get help? So many times if I ask the parent कि अगर इसे कुछ चाहिए होता है, क्या ये फिंगर से पॉइंट करके बोलता है कि बताता है? तो the most of the time the answer is हाँ ये हमको इशारे में सब कुछ समझा देता है, फिंगर से भी पॉइंट कर देता है. तो when I ask them for an example, आप बताओ, तो अगर इसको पानी पीना होता है तो ये पानी की बोतल आकर मुझको दे देता है और मैं उसके खोलकर पिला देती हूँ. So again, this is not the finger pointing, but when I just give the form to the parent, they may just interpret it as finger pointing. So it is very important we understand you're talking about a mature index finger pointing here. And I have highlighted this yellow area where basically it means this area, which is whether the child is reaching for object with his or her whole hand. The child is leading to the object, like the child may pull the mother's dupatta or the hand of the parent towards the object, or try to get the object for him or herself, or ask for it using words or sounds. Like child may not look at the mama, he may do, but he may not point. So again, this doesn't mean the child is doing it right? So we have to now look for whether what we can understand through this. I'll just try and shift. There's some problem, it's kind of hanged. I'll just share it again. Yeah, so if the child is not pointing, but child is doing all these gestures, then we may ask again the family to see if the child, if you say, show me, kya chahiye, or you ask something, does the child point? If the child is not pointing, that means the child is not pointing. So it is a failed response and we mark it as no. So even the parent may have interpreted in a way that child at least gesture se samjha pa raha hai pani chahiye, but this is not a mature gesture. So which is a failed response if the child is not doing index finger pointing, and we mark it as fail. And this is what is called a proto-imperative pointing in terms of the pointing, mature pointing. So there are two types of pointing. One is the proto-imperative pointing, which is done when the child needs something. And other is the proto-declarative pointing, which is done when the child wants to share the joy or share the emotion. So coming to the seventh question, which is about the proto-declarative pointing. So we ask the child, we just talk about pointing to ask for something. So right now we want to see whether the child is pointing to ask for something or sharing the joy, right? Yeah, so here it is. So basically when the child is interested in something, like child sees a metro and he starts pointing or looking at the parent, or child sees a crane or a truck, child is pointing. So that is the joy the child is wanting to share with the parent. So here the pointing is more to express joy and share with the parent or show his interest, but not to get help. Like in the previous question, the child was pointing to get help. So here the child is pointing to show interest and not to get help. And if the child is doing that, we say it is yes. And this becomes the proto-declarative pointing. So a lot of children who are on the spectrum will maybe doing a immature proto-imperative, but they are hardly doing any proto-declarative pointing. So absence of this is more of a hallmark of a child on spectrum. So this we have to keep in mind. Coming to the next question, which is the question number 8. The question is your child interested in other children? So now again the parent may be little confused कि कभी तो बच्चों को देखकर खुश होता है, कभी पर खेलता नहीं है, but कई बार दूर से देखकर स्माइल करता है या जाकर उनको हक करना चाहता है. Mostly they will say this. So again the important box here is this. Does your child play with another child? Does your child talk to another child? Does he do ba 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 or any noises when he sees the another child? Does he watch and smile the another child? And he may be shy initially, but then smile later on, or may get excited about another child. So if the child is doing yes, so mostly the child is doing and the response will be yes, but only if the child is doing it more than half of the time. So many times when the response by the parent is कि कभी करता है कभी नहीं करता, we will simply ask कि ये mostly करता है 50% टाइम कर लेगा, 10 में से 7-8 बार ये ऐसा response दे देगा. So that means the child is doing it most of the time and we mark it yes. Because very rarely we will see a very like a all or none kind of response कि child हमेशा ही कर रहा है और child हमेशा नहीं कर रहा है. So mostly the parent are reporting कि ये कभी करता है कभी नहीं करता. And the trick to solve is कि whether he is doing most of the time or more than 50% of the time, then the response becomes yes. Coming to the question number 9, which is, does your child show you things by bringing them to you or holding them up for you to see? Not just to get help, but to share. Again, it is like a proto-declarative gesture where the child is wanting to share and he is not getting things to just for help. So for example, many times a parent would say कि हाँ ये हमको लाकर देता है, अगर इसको कोई नमकीन खाना है, डिब्बा नहीं खुल रहा, ये मेरे पास लाके देता है, मैं डिब्बा खोलकर देती हूँ उसको. So this is again not a gesture or not a response where a child is wanting to share for the joy of sharing, but the child here is trying to get help. So again, we have to be very careful and mindful whether the child is doing it to get help or just to show. If the child is doing it to get help, then the child's response should be no. If the child is doing it to to make you interested in the child or to share the joy, then the response is yes. So there can be numerous examples, like here the examples are a picture or toy just to show you, a drawing he has got, or maybe a smiley face or a star which a nursery teacher has given to your toddler. And all these things, if the child is doing not to get help, then the response is yes. Now coming to the 10th question, which is, does the child respond to call his or her name? Again, it's a little tricky question. Parents are confused. They will always say कि हमें समझ नहीं आता, ये तो कभी करता है, कभी नहीं करता है. So what are the past responses in this? When you do a name call, so the child either is looking up, the child starts to babble or talk to you, or a child may stop to do what he or she is doing. So the child these are the past responses. But if the child does not make any response, he may have heard but ignores the parent and respond only if the parent is right in front of child's face, very close to the face, or respond only if touched. So again, many times the parent would say, ki, suppose a child name is Vivan toffee. So, and the child turns, that doesn't mean child is responding to the name Vivan. Child probably wants toffee and understands the toffee is being offered. So child may respond. So we have to be again mindful about how the child is responding. And again, when the parent is in a dilemma, ki kabhi karta hai, kabhi nahi karta. So the trick is to solve it, to ask which one he or she does more often. Is the positive response more to the name, mostly, more than 50% of the time, or most of the time, out of 3 out of 10, the child has ignored the name call. So this helps us to decide whether the child is responding to the name or not. So these were the 5 questions which I was given. So
thank you, Dr. Shambhavi. Now I request Dr. Praveen Suman, ma'am. I'll just share the screen.
Hello. Am I audible? Hello. Good afternoon, everyone. So today is the day of technical problems. So I'm also in a technical mess.
Is the screen visible now?
Yeah. Screen is visible.
Just try to make it.
So Dr. Shambhavi has already elaborated most of the questions, very important questions of the Mchat. which needs to be done. And थोड़ा सा इसको बड़ा हो सकता है screen? हाँ,
I'm trying to do.
Hello, Dr. Tilak, our chairperson. So, should I start?
Full screen कर दो.
So-
Full screen नहीं है.
Actually, is the screen visible? Is visible on the screen?
I can see rest of the people. I don't know. I
Just
think
Yeah, the
it's
screen is visible.
Yeah,
It is not
yeah.
full screen. Yeah, now it is
Now,
okay.
now it's better.
Now it is full screen. it's ज़्यादा ही screen हो गया, वो बाहर ही चला गया screen से. कैसे करें उसको?
Just one.
थोड़ा सा small कर दो.
Is it okay now?
थोड़ा सा छोटा कर दो, थोड़ा सा छोटा. I can see. Small ही कर दो, वो ज़्यादा better रहेगा. हाँ. ये ठीक है. So, ये तो बहुत बड़ा हो रहा है. इसका चार्जर चाहिए, ये क्या लगा है? अच्छा ठीक है. अच्छा.
Is it visible now?
Yeah. अभी तो नहीं, विजिबल तो नहीं है. छोटा कर दो. आई थिंक डॉक्टर अजय, यू कैन मेक इट स्मॉल ओनली.
ऐसे ठीक.
हाँ, थोड़ा साइड में हो सकता है. आई कैन नॉट सी, इट इज इन द मिडल. और थोड़ा सा राइट में आ जाओ. अदर साइड. हाँ हाँ, दिस इज बेटर. दिस इज फाइन. So let's discuss the next question in Mchat. So till now we have learned that the Mchat is a screening tool, not for diagnosis. And this is not फिर चला गया वापस, कहीं चला गया, क्या हो गया? हाँ ठीक है. So this is not a tool only for diagnosing autism. It is a tool to diagnose developmental delay and autism. So very, very important. If there are few questions which are not particularly for autism, but developmental issues as well. So which we'll be discussing. When you smile at the child, or for example, Vivan is the child, does he smiles back at you or not? So if the mother says yes, then it is pass. But if mothers, most of the time in older children, this is a question generally for a very young children, but for older children, generally mothers, I'm yet to see a child who can smile nahi karta. Most of the time they are smiling back. Then you have to actually ask the quality that when does he smile? वो अपने आप से स्माइल कर रहा होता है कि जब आप इंटरेक्शन करते हो तब वो स्माइल करता है. फॉर एग्जाम्पल, a child is sitting and father comes from work or mother comes from work, तो वो उनको देख के स्माइल करना. So that's more of a social smile rather than, क्योंकि हम social smile as a pediatrician हम क्या confuse करते हैं, 2 महीने के बच्चे में जो करते हैं ना, बात करें तो आगे से स्माइल, बस that's not enough. For older children, for journal purpose, like child looked at you and he's happy about it, so that should be the social smile in older children. So if you'll see niche, does your child smiles when you smile? Yes or no? Does your child smiles when you enter the room and smiles when you return from being away? तो आप आए हो बाहर से, तो जस्ट आपकी प्रेजेंस से ही वो खुश है. That should be the important message. और अदरवाइज पेरेंट वुड से कि वो स्माइल करता है, हमेशा स्माइल करता है, वो तो अपने आप से बैठ के टॉयज के साथ भी स्माइल कर रहा होता है, स्माइल्स रैंडमली इन पर्टिकुलर. सो दैट इज नॉट अ सोशल स्माइल. आवर कंसर्न इन ASD children is majorly social interaction and social communication. So he should be interacting with other people, looking at them, and then smiling back. That's a social smile. So if it is yes, then only he passes the question. Otherwise, he fails on that question. Can we go to the next question?
Is it visible?
नहीं, उधर है, उस साइड में हो गया, राइट में है, थोड़ा सा उधर कर दो. It's on more, हाँ, थोड़ा सा, yeah. So does your child get upset with any sound? So that is a very important question. Why do we ask this question? Is because there are hypersensitivity towards sounds, or there can be sensitivity issues in these children, sensory issues, which can be due to loud music, which can be due to any very peculiar thing is, अगर आप पूछोगे वो कहेंगे कुकर की सीटी से डरता है. So which is a very very peculiar. अब ऐसा नहीं है कि दूसरे बच्चे नहीं डरते. I have seen in my practice that other children who do not have autism may have a history कि वो कुकर से डरते हैं. But when there is a history, he always, मतलब इतना बड़ा हो गया बच्चा, 2.5 साल का, आज भी वो कुकर की सीटी जैसे ही बजती है तो वो बहुत परेशान हो जाता है. कितना परेशान होता है, that we will see. कि वो अपने कान बंद करता है, tells that he doesn't, और या वो बोलता है आपके कि मुझे अच्छी, जो बच्चा अगर ऑटिज्म वगैरह का नहीं होएगा, वो पास हो रहा है, तो वो कहेगा कि आई डोंट लाइक दिस साउंड. Whereas a child who has a social communication problem, we would say he will start shouting or he will start crying or he covers his ears. This is a very peculiar, symptom. You will say कि वो आते ही अपना कान बंद कर रहे हैं. क्लिनिक में भी आप देखोगे तो वो अपने कानों को बंद कर रहे होते हैं. So these are very important signs of autism. वो डॉक्टर अजय थोड़ा सा हिल गया फिर से. हाँ, सॉरी.
देख रहे?
हाँ, अब ठीक है. So any child, loud sound say all of us can get upset. So this is not the important criteria. The important criteria is he gets upset with daily noises. For example, washing machine, baby is crying, vacuum cleaner, hair dryer. These sounds are there every day, and one gets accustomed to these kind of sounds. Hair dryer, traffic, baby screaming, loud music, telephone doorbell ringing, noisy places. So there can be sounds for which child gets upset, but if he really gets upset and he covers his eyes and tells his mother that he does not like, then that means he's upset, but he can manage that problem. That means it is not a problem. But if he's upset and start screaming and gets very very upset, and the parents also, it affects your functionality. For any disability, it is very very important when we are looking that the functional impairment should be there. अब मुझे कोई आवाज पसंद नहीं है, there are few sounds which we don't like, screech की आवाज आती है, तो उससे we get upset. That does not mean that it is a problem. We do get upset by different sounds, but it should not create your day-to-day problem that कि घर में कुकर की सीटी बजना ही मुश्किल है, खाना बनाना ही मुश्किल है, जैसे ही आप मिक्सर चलाओ, child gets upset. So these are very important signs. Can we go to the next sign? Next question. Does he walk? Does your child walk or not? So as I told you that this is Mchat is not only for autism, it is for developmental delay also. And children with autism may have walking difficulty or may not have walking difficulty. So this question, if he walks, then he passes this question. If he does not walk without holding on to anything, or especially like by 16, normally we start doing Mchat by 16 months onwards. So by this time, child should be walking independently. So if he's failing, so anyway, he needs early intervention. Next slide. थोड़ा सा इधर डॉक्टर अजय. हाँ.
Is it visible?
No, it is not visible. थोड़ा सा और on the left side, थोड़ा नहीं, other दूसरी side और थोड़ा सा. थोड़ा सा और कर देंगे, थोड़ा सा. Can you make it little more this side? ये मेरा actually.
Let me read the question. Does child look you in the eye when you are talking to him or her, playing with him or her, or changing him or her?
So whenever you are looking at the child, he should be interacting with the child, he should be making an eye contact and looking at you. थोड़ा सा इधर कर दो, हाँ, so it will, हाँ, ठीक है, this is fine. When you are playing with him, especially during feeding, but यहाँ तो most of the time क्या होता है, वो तो बच्चा फोन देखते हुए ही खाना खा रहा होता है. तो very importantly we have to ask कि whenever you are interacting with the child or you are changing the diapers or you are for older children, you are talking to him or reading the books, you can see that whether he's looking at you or not. If yes, most of the time वो देखता है, yes to 2 or more, then he passes. वो कभी कभी देखता है, then does your child, तो उसमें we have to ask another question, does your child look you in your eye every day, मतलब रोज वो आपको लगता है आपको देखता है कि नहीं देखता. Then if he says, she says, on a day when you are together, does he, she 5 बार से ज्यादा देखता है, जैसे पूरा दिन आप उसके साथ हो, संडे है और any other holiday when you are with the child, do you think at least 5 times वो देखता है? If yes, then it is yes. If it's no, then it fails on that test. So I know most of the time will not be able to this much asking, but this is a very simple question कि वो आपको देखता है या नहीं देखता है. Most of the parents will be able to answer this question. This is a simple question which should not be a problem. Next हो गए 15. Next क्या है?
Visible?
Yeah. So yes, this is question number
15.
Yeah. So does your child try to copy you? Is very very important. So the mother says yes, वो मुझे पूरा copy करता है. Especially this is called, copying is called imitation. Imitation and joint attention are two very important aspects of autism. The child has a deficit in joint attention and imitation skills. So joint attention के लिए, as Dr. Shambhavi has discussed, proto-declarative and proto-imperative pointing, and for imitation, most of the things we learn from copying. So there can be visual imitation, verbal imitation, and different types of imitations are there. But for at least यहाँ पे we can कि जो हम कर रहे होते हैं कि वो करता है. So simple things like आप अपनी जुबान बाहर निकाल, does, if you stick out your tongue, does he copy that or not? When you make funny sounds and wave goodbye, bye bye, hello, clap your hands, so is he able to do that? So most of the time children of with autism by जैसे 1 साल पे 1.5 साल पे आते हैं, तो they are not bye bye नहीं कर रहे होते हैं, उल्टा कर रहे होते हैं. They find it difficult to imitate, and later on these skills affect the learning of the child. So if he does it most of the time, you ask these questions. If he does most of the time, yes, 2 or more times in a day, so it is passed. If he says नहीं, कभी कभी करता है, तो कभी कभी और बहुत rarely करता है, तो we would consider it as a fail. I think rest of the questions will be taken by the next speaker.
Thank you, Dr. Praveen. Now I request Dr. Jyoti Bhatia ma'am to please continue with the next. Would you be able to share your screen?
Yeah,
should
I'm
I?
trying to share my screen. Do I have the right to share the screen? Just a
Yes.
minute. Okay.
Mrs. Sushil? Can you see the green button? Please press that.
Yeah, I'm trying it. Just a minute. Okay, no, I'm not able to share. Dr. Ajay, can you get it shared, please? I think some
Let me try.
accessibility issues there. Yes, I've been able to share. Can everybody see my screen?
Yes, ma'am.
Yeah. Thank you so much. And thank you, Dr. Ajay. Thank you, East Delhi IIP, and thank you, chapter, for giving this opportunity to share and interact. Thank you all the speakers for covering the first 15 questions. So going further with the rest of the questions of Mchat, I'll switch it to full screen. Yes. So it's a screening tool to pick up autism early. And when it was developed, basically, all those symptoms that come early were taken into account so that at 18 months, we are able to pick it up. I have a slightly different format. I've tried to connect the questions to the impairments that occur. If you feel it is too detailed, please, the chairpersons, let me know. I'll try to stick to the questions only. So question 16 says, if you turn your head to look at something, does your child look around to see what you're looking at? So this is the follow-up sequence to that. So the question says कि अगर आप मुड़कर कुछ देखते हो तो क्या बच्चा भी उस तरफ देखता है? So as Dr. Praveen Suman also said, Dr. Shambhavi also said कि parents को कई बार question समझ ही नहीं आता और वो yes कर देते हैं. तो it is important for us to be able to explain to the parents. So इसमें हमारा जो है the yes responses, if the child looks at that thing, तो हमने जब उस तरफ देखा, क्या बच्चे ने भी उस तरफ देखा, या बच्चे ने उस तरफ पॉइंट किया, या बच्चे ने एक अवेयरनेस के साथ ढूंढने का कोशिश किया कि हम कहाँ देख रहे हैं. And if the child ignores or is looking only at the face, then it's a fail. And any of these past responses is a past item. So this item, as Dr. Praveen Suman also said, joint attention impairment is a very important feature which comes early in autism. So joint attention, I'll have put some slides to talk about joint attention. So joint attention is when two people look together, like we are all looking on these slides. So we are jointly attending to these slides. And why do we do it? Because we feel socially connected and we are interested in the same thing and we want to learn and understand each other. So this joint attention that we have right now is actually what we developed in infancy. Now, when we have a child who is developing autism, joint attention is something that doesn't develop or is weak. So a lot of these questions that we have on Mchat are related to joint attention, all that pointing, response to pointing. So what happens here is we have a child and we have an adult. The adult does something by looking or pointing or by tone of voice and looks at the child. And the child who is already interacting with the adult understands, looks there and looks back at the adult. So this is what is joint attention. And we can clearly see that this kind of an interaction is a very important precursor for the child to develop language and communication. And what is called theory of mind, when a child has joint attention, he can actually try to understand that the parent is interested in something and in what way. So if we look at this question again, if you turn your head to look at something, does your child look around to see? So parents have alerted the child has become aware, the child is interested, the child follows the gaze. And because of this, the child can understand parent ka gesture, so non-verbal communication, word, and why the parent is doing it. So the child can learn what that word means. The child can understand that this is important. And my parent is also thinking about it. And this is a fundamental ability to build relationship because parents can share experiences and knowledge. And naturally, all infants are highly motivated to do that. We say that if a small baby at that age is more interested in objects rather than people, it is not a normal developmental pattern. So I've just put together some pictures. So we have this first picture in which we have this basic social smile. So the child has a focused gaze on the parent. And around 4 to 6 months, when the parent shows a rattle, the child shifts from the parent to the rattle and looks back at the parent. So that joint attention is starting. And around 9 months, when the parent points to something, the child also looks there. And around 15 months, the proto-declarative pointing that the child uses his pointing to get the parent's attention. So does your child get you to watch him or her? This is the next question, question 17. So basically this question is कि अगर बच्चे ने कुछ अच्छा किया है, क्या वो पेरेंट की तरफ देखता है कि उन्होंने देखा कि नहीं, वो प्रेज कर रहे हैं कि नहीं? So these are the positive responses. If the child has done something, he wants to share. So if he says, देखो, look, or he makes a sound to get parents' attention, or he looks at the parent कि parent ने देखा है कि नहीं देखा है, or basically when we have autism, the child is busy in his own world. And the basis of this is an impaired emotional reciprocity. We know that the core deficit, social emotional reciprocity is reciprocal interaction. So parent ने कुछ social input दिया, बच्चे ने कैसे वापस return किया, बच्चे ने कोई social input दिया कि नहीं दिया. And in autism, we know they are in their own zone. So they do not initiate interactions. Plus, when they have a feeling, they will not actually want to share it. So this is 17th question. Then we come to 18th question. Does your child understand when you tell him or her to do something? For example, if you don't point, can your child understand questions like put the book on the chair or bring me the blanket? Now, this is related to receptive language. We know that language delay is one of the earliest red flags of autism. एंड इसमें जो कंफ्यूजन होता है बेसिकली जब ऑटिज्म में लैंग्वेज डिले है सो लैंग्वेज हैज टू पार्ट्स अंडरस्टैंडिंग एंड स्पोकन डिले पेरेंट्स को दिख रहा है कि हमारा बच्चा बोल नहीं रहा लेकिन वो समझ नहीं रहा ये पेरेंट्स को नहीं पता चल पाता और क्योंकि बच्चे मोस्टली इंटेलिजेंट होते हैं थ्रू लुकिंग एट द एटमोस्फियर दे स्टार्ट अंडरस्टैंडिंग अ लॉट ऑफ थिंग्स सो पेरेंट्स से हाँ ये सब समझता है लेकिन इंपॉर्टेंट चीज जो पेरेंट्स मिस कर जाते हैं इस क्वेश्चन में और रॉन्गली आंसर कर जाते हैं इफ यू डोंट पॉइंट कैन योर चाइल्ड डू दीज थिंग्स सो पेरेंट्स विल फ्रीक्वेंटली से कि भाई हम पार्क के लिए तैयार होते हैं और बच्चे को बोलते हैं शूज लेके और वो लेके आ जाता है नाउ दिस इज समथिंग दैट द चाइल्ड हैज लर्नड बाय वाचिंग द पेरेंट्स पैटर्न ओवर टाइम वो रोज देखता है मम्मी शाम को तैयार होती हैं फिर मुझे शूज लाने को बोलती हैं फिर हम पार्क जाते हैं. So with that sequence, the child automatically brings the shoes, even if he understands only the word shoes. So is level ka receptive understanding hai ki nahi? That is the actual question. And there are 3 more questions that have been given in the follow-up. Show me your shoe. तो अगर कोई hint नहीं दे क्या बच्चा अपना shoe आगे करके दिखाता है? Bring me the pillow or the blanket. अगर हम कोई इशारा नहीं करते पेरेंट्स एक naturally उनका इशारा आ जाता है तो क्या बच्चा इतनी instructions समझता है? Put the book on the chair. So these are usually जब हम clarify करते हैं तो usually ये pass नहीं होता है जब when we have autism symptoms. So language development, I'll skip this part. I'll quickly go through it. So receptive and expressive both is delayed and this is autism is one situation जहाँ पर understanding बोलने से कम होती है. These are children who may start talking. They may say alphabets. They may speak rhymes. They may learn to speak the words that are useful to them. Because वो दूसरे के साथ बात करने के लिए communication is not developing, but they learn the words that help them to regulate their environment for their benefit. But understanding is something that lags behind. So coming to the next question. If something new happens, does your child look at your face to see how you feel about it? Now, this is something that is related to what we call social referencing. I have a video also. I'll try to play it. If we don't have time, it's okay. You can let me know. I'll not play it. So what
we
is
have
social...
time. You can play. No.
Okay. Thank you, Dr. Ajay. So social referencing is again, jab bacha, when he's developing, and something new comes, the child refers to the parents and primary caretakers to understand whether it is safe, whether it is pleasant, whether it is friendly or not. That is how he starts developing relationships with other people. So, अगर कुछ नया होता है क्या बच्चा आपका चेहरा देखता है? Again, parents will frequently not read this question correctly. So we have to tell them कि कोई अजीब सी आवाज आती है या कोई डरावनी सी चीज आती है या चलते चलते सामने कोई लिजर्ड आ गई तो क्या बच्चा आपका चेहरा देखता है बिफोर डिसाइडिंग कैसे रिएक्ट करना है या अपनी मर्जी करता है. So when we explain the question properly, mostly the parents will then think and say नहीं हमें नहीं देखता है अपनी ही मर्जी करता है. So social referencing develops in later infancy and when confronted with a new or unusual event, infants look at an adult and base their subsequent behavior on the facial expression of the adult. And they use the emotional cues of the adult to decide whether to approach it or to avoid it. So this is a video showing social referencing. So that was social referencing. Just a minute. Yeah. So coming to the last question, does your child like movement activities, for example, being swung or bounced on your knee? So the question says कि हवा में उछालते हैं बच्चे को या हम bounce करते हैं अपने knees पे. Does the child like it? So again, the past responses is that the child is actually enjoying it, because these are games children usually enjoy. So does the child laugh or smile? Does the child try to talk or babble? Does the child want more by holding out his arms when you stop? Now, why this is usually not happening in autism is because of something called gravitational insecurity. Autism, one of the DSM criteria is hyper or hyporeactivity to sensory input. Now, this is, we have our sensory input, so visual, smell, taste, touch, hearing. Then we have vestibular and proprioceptive. So in autism, children may be hyporeactive, that is, they receive it less, so they may want more of it, or hyperreactive, that is the same thing may be feeling more strongly to their system, so they may avoid it. So usual movements may be too strong for them, and that is why they are not enjoying it. So it's a type of vestibular hyperreactivity. So these sensory symptoms are also very common, and they do come early. So they are a part of screening questionnaire, and gravitational insecurity is something that can be commonly seen. So I think that finishes all the questions, and Dr. Kanwal has already talked about how to interpret them. And that's it. Thank you. Thank you. Back to Dr. Ajay. Thank you so much.
Thank you, Dr. Jyoti, for a wonderful presentation. Please stop sharing
I'll
the
stop
screen.
the screen sharing. Yes.
So one of the commonest question is if the scoring is little on the higher side, so should we repeat it or observe the child for some time? In the meantime, what instructions to be given to the mother?
Hello.
Uh,
Hello. So this, when you said the score is on the higher side, for that only the esteemed speakers have given those explanations of the questions. When we feel that the score should be higher, but the parents have not responded appropriately, is when we ask those, we ask the questions in a detailed manner, which all the speakers elaborated on these questions. So that at that time itself, there's a clarification, the score can be changed. Otherwise, we can call them back for review after 1 month. And at that time, we can ask the questions and get a proper score out of it. Because most of the times, either parents are in denial or they don't know the exact answer.
Shamli, can we suggest some simple activities to the mother till the time she comes back, how to interact more with the child?
Right, so, sorry, so I'm
because
sorry.
even in the early child development program, we in the MCP chart, we tell the mother some activities. So can we simply suggest once the child has come at say 18 months and the score is little on the higher side, so how to interact with the child or what can be done?
Right, so the question is addressed to me.
Yes.
Yeah, thank you. So I think the one thing which you mentioned, MCP card, is a wonderful illustrative card where a lot of activities are there right from the onset of the birth to the early 3 years of age. And specifically when we talk about in a toddler age group, so a lot of children by 18 months should have their non-verbal communication in place. We're looking at the parent having a facial attention, having simple actions to imitate. So the parent can at least work on this non-verbal part of the communication before they go for any other therapy. And to enhance that, I think a lot of good quality play where they make the child look at them. So by play, I mean, many times they say कि खेलता तो बहुत रहता है, blocks बना लेता है, puzzles बना लेता है, but that's not the play we're talking about. We're talking here about more of an interactive play where the child has to look at the parent, smile, try and copy, give them some actions to copy, give them some social gestures like if flying kiss kar do, bye-bye kar do, give them, maybe they can teach them some body parts like eyes kahan hai, head kahan hai. So these are the simple developmentally age-appropriate activities which a 18-month toddler should start doing. And the parent should emphasize to first kind of teach them these before going into the verbal part of the program.
Dr. Lata, what is the effect of screen usage, increased screen usage
Yeah.
on this?
So we are seeing increasing number of autism-like presentation to increase usage of screen. So there are a lot of kids who come to us that maybe in the first 1 year, the child was developing normally, eye contact was good, social smile was there, child was pointing at the finger pointing was there, child was responding to the name. And all of that, then they start screen. Generally, the screen is started around 6 to 7 months when they start feeding the child. खाना दिखाने खिलाने के लिए स्क्रीन दिखाना शुरू करते हैं. So then gradually they say कि 1 साल आते आते regression शुरू हो गया. Normally also in autistic children there can be regression, but generally it happens around 18 to 24 months. 1.5 साल से 2 साल के बीच में regression होता है. But nowadays we're getting this kind of history कि we felt the child was okay till 1 year and we started screen around 7 to 8 months और उसके बाद हमें लगा कि धीरे-धीरे इसका eye contact जाता रहा. So we are observing that the screen is causing autism-like symptoms, and the moment we advise the parents to stop screen and start interacting with the child, at least 30% improvement तो आ ही जाता है. For the rest 70%, we definitely have to give some stimulation in the form of therapies for them to improve. So the IAP and AAP have come out with guidelines that the screen time should be 0 till 2 years, and after that about 1 hour per day for educational purposes only, till I think 2 to 8 years. So we are seeing such cases here.
Dr. Multani, sir, are there any medications available? Sometimes some MRs come with to us, sir, DHA, it is very good for the brain development or this and that.
Key question.
Dr. Gupta, yeah, I would like to definitely answer this with a yes, but sorry to say there are no, right now, no medicines which are there for the core symptoms for autism. There's no treatment for autism per se. There are some medications which are available for the comorbidities like ADHD and epilepsy and other comorbidities. But as of now, like we are talking right now, there's no specific treatment for the core symptoms. So that is why we have to go with the multidisciplinary team and start enabling the parents. And I think Dr. Lata and Dr. Shambhavi very nicely pointed out that one is we should reduce the screen because these children, they have an inherent tendency to go for objects than humans. So bring the focus back on humans so that the child will learn by mimicking the social behavior that he or she is seeing. While with the object, there is no reciprocity. It is simply a one-way transmission of screen that is happening with the child. And it is quite easy. But as you see, it is not easy to interact with another human being to anticipate what the other person is thinking. And that is what they say, the theory of mind. As the child grows, physically, most of these children, they grow well. So that is why everybody is perplexed that physically this child looks okay. But why he or she is not behaving appropriate to his or her physical size. So that is the place where these children lack, that they have grown physical in size, but the mental age, like since they are not socially interacting, and many of them do not have a good speech, they have issues. Or some of them, like I think Dr. Shambhavi had mentioned, some of them have picked up some speech, but then this is that repetitive speech or echolalia that is there. So that is why it's very important to bring the parents on board whenever we are trying to help these children, because the parents have to agree and be a part of the treatment, because they are the huge pillars of support for this child. They form the initial environment of the child, and that through them we can help this child to a great extent.
Thank you. Dr. Tilak, we have questions or comments?
Okay, just I like to add one thing. In the clinical practice, like we have always been told that most errors in the clinical diagnosis are not because of the incompetence or inadequate knowledge, but many of the times we are under the pressure of the time or in autism, I'd like to add that the denial is not only from the parent side. Many of the time it is the clinician also, शायद बोल लेगा ठीक हो जाएगा करके. Many of the times they try to postpone the event. And this is a very simple screening tool, as Dr. Kamaljeet already said, that if the score is more than 8, it is better to evaluate by a developmental specialist rather than postponing it again and again, because you may lose the patient and the child may not come again. So once you have done it in your clinic, and it is very simple, when the child is coming for routine vaccination between 15 to 18 months of age, so you can simply ask the parents to just go through the chart, and as our esteemed faculty has elaborated on each and every questions. So it is only in the time of when we are having some doubts, when the parents are in the doubt. Otherwise, most of the parents are intelligent enough to say yes or no or pass or fail. So it's very simple tool. And if the score is more than 8, it is better to refer, at least tell them, write on the prescription rather than postponing it more and more. You may lose the child may never come again. That's my point.
Well said.
Dr. Jyoti, you want to say something?
No, that's
Please
very
go
well
ahead.
said, Dr. Tilak. I think it's very
Dr.
important to pick them up.
Dr. Lata, is it important to screen all the children at 18 months? Say they're visiting us either at 15 months for the MMR and chickenpox, or at 18 months for the DPT booster, or
Yes,
maybe
naturally,
sometimes. Is it important to screen all the children, or wherever we suspect the child is having some problem?
see, that will be the ideal thing to do actually. Considering the fact that the incidence of autism is increasing, now currently it's 1 in 40. So ideal thing is to screen every child, but at least because American Academy of Pediatrics, they say that at 18 months, all children have to be screened. But at least we can screen those children who are at high risk for autism, or if the parents are coming with their doubts. So the high risk for autism are where there is increased maternal paternal age, or if the mother is on certain medications like sodium valproate, or if there is a family history of first child being autism, the child family history of deafness, the history, or if the child is suffering from one of the chromosomal abnormalities, or the family history of chromosomal abnormalities. So the list of high risk is there. Even a follow-up case of a preterm child should also come under that high risk. So these children definitely we have to keep in mind. A pediatrician should have a list of these, and these children definitely should have their screening at 18 months of age. For others, if the parents approach us, we should definitely screen. And if we have time, then we should screen all children. One more thing I want to add here was, most of the parents say, हाँ हमारा बच्चा बोलता है, right? But we have to make, जब आप लोग vaccination दे रहे हैं ना बात कर रहे हो, तो just observe the many children who speak, the ones who are milder on the spectrum, they'll say, मुझे ये चाहिए, पानी चाहिए, chocolate चाहिए, दे दो, दे दो, दे दो. Echolila will be there, and then it's only need based. It's not a to and fro communication. Most parents don't understand this. That this communication is not to and fro, it's only one-sided. So this is one situation where most pediatricians are missing, where it's a mild case, which can be easily recovered or reversed maybe, and we can make the child almost at least reduce the symptoms, or make the child more fitted into the society by addressing early. These are the best actually cases where we like to work with. But these are the ones which are missed. But yesterday only I had a child who was 3 or 4 years old. He was talking everything. So initially I thought ये बच्चा आया ही क्यों है? हाँ ये तो बिल्कुल ठीक लग रहा है. But when you start observing closely, then you see कि ये तो खाली one-sided चल रहा है, solo conversation चल रहा है. So maybe paying attention to these small things matters.
I agree with you, Dr. Lata. I think you very well said that we should try and screen all children in 18 and 24 months. The AAP and now the IAP also said that this should be done for all children, because we have a large amount of population who requires this.
Yeah.
And it's the earlier you pick up, the earlier you treat, the better the results. And most of the children, they are in that mild or moderate spectrum of the disorder who can be very well helped. There's a small minority of children who are on the severe end of the spectrum, and they will definitely like, but still, if we pick them up early, we can do a major change in their and their parents' life. And the child can have a much better future than without any help. So I think this is what we all should take 5 minutes of our OPD time. And I agree. I think Dr. Tilak very nicely said that we don't have time at times, patients don't have time. But if we show concern and if you tell the parents that right now it's a busy OPD, but please visit me on a separate day and time, so that I can spend those extra 5 minutes with you, and maybe you can give a piece of paper, because Mchat comes on a single sheet. You can just hand it over to them and tell them, bring it back. And then on that day, spend 5 minutes with the family explaining why it was done, what is the score, and the way ahead. I think definitely most of the times everything will be fine. The score will be less than 2, and parents will be happy, and you'll have one more satisfied customer added to your list of loyal patients will come back to you again and again.
Obviously.
Dr. Niti, there are some questions in the question answer box. Can you ask them? Dr. Jyoti, you want to
Yeah,
make
just
some?
wanted to ask, basically Mchat online is also available. So many a times after initially talking to the parents, I tell them to sit outside and fill it online and we get a score. So intelligent parents can easily do it. We don't even need the sheet and we don't need to do any scoring or check it also.
Yeah.
What my usual practice is, I've kept printed Mchat charts with me. So once they visit at 18 months, I hand over with the date written on it and date of birth written with the child's name, and ask the mother to go home, do the question answer, and send a photo to the clinic. So that in your free time, you can go through those questions.
Yeah.
And when next time, you can easily advise them without wasting much of your time. Dr. Niti, there are some questions. And Dr. Shambhu.
Yes, sir. So just to add one thing, I think many times we always hear about busy practices and busy pediatricians. I think if we also have a display in the waiting area and maybe just a poster on the red flags of autism, or just a simple A4 sheet ki every child at 18 months have to have a Mchat and please take the form at the reception. I think even the parent would start asking the pediatrician about, give this form jo 18 months pe bharna hai. So अगर pediatrician के दिमाग से भी निकल जाएगा, वो parent को याद रहेगा कि मेरे को ये लिखा हुआ है और maybe I have to ask my doctor कि ये कैसे भरें. So I think that also can be done.
That's a great suggestion. Dr. Niti, are you going to ask the questions in the question answer box?
I'm not able to see.
There's one question by Dr. Pooja Sharma. Do these children have difficulty in toilet training? Dr.
So
Jyoti?
should I?
Yeah, Dr. Lata,
Basically.
please go ahead.
Yeah. So most of these children, since they don't communicate and their comprehension is also poor, most of them. So the activities of daily living are delayed unless we specially train them. So toilet training is a part of it. We have to, because they're visual learners, so we train them, we tell the parents that keep pictures in the house. You can take a copy and keep the pictures in the house of how to indicate when you have to go to the toilet and how we are going to take you to the toilet, take out your panties, sit in the toilet. So all pictorial representation of the sequences of toilet training has to be done. Then only most of the children learn. It's not like that. They will not learn so easily like other children do. They have to show everything visually.
Yes.
So this
So
is delayed. Yeah, toilet training is delayed.
Would you like to add anything, Dr. Jyoti?
Yeah, basically it depends on the communication level of the child. So as Dr. Lata said, if it is a non-verbal child, so it is difficult to explain to the child, and the child also does not communicate. So those visual schedules come in very handy.
Yeah.
Otherwise, yes, behaviorally, we have to make them practice how to indicate. We have to help them indicate after they get some indication. So some children are jumpy. So we tell them a word and we help them slowly use that word to tell. So yes, it is difficult. It is very individualized. So every child has a different challenge. So we need to see individually how to guide the parents.
Dr. Praveen, is developmental screening, for example, DDST is must before doing Mchat?
No. There are different types of screening available. One is for developmental screening, for example, TDSC, random developmental screening, and DDST, which will include all the domains of development majorly. But Mchat is majorly done after 18 months, between 18 months to 30 years, majorly focusing on the social communication aspect. So there is ideally all children, as we are discussing, ideally all children should be screened for all the developmental problems, not only for autism only. Autism is one of the important problems. So if a child who is not sitting at 6 months, a child is not walking at 1 year, all these things are also important, which because motor skills can be picked up, by physical examination. So they are easy to pick up. Whereas these behavioral and social communication are difficult to pick up because there are no physical signs and symptoms for which we pediatricians are much more trained. So that's why we are stressing at least do Mchat to find out if there are any developmental or autism problems. But otherwise, developmental screening should be done for all the children, starting from, normally recommendation is 9-12 months pay, should be done at least once in a year, should be done. But not necessary. For example, a child who has come and you're doing Mchat and uska dusra screening nahi hua is not a contraindication.
Dr. Lata, a child, say 3.5 years of age, has come to my clinic, and I suspect some features suggestive of autism, but now I cannot do Mchat, or I can still do it, but it will not be validated.
Yeah.
But it will still give some idea. What should be done for a regular pediatrician,
Ideally,
not as a specialist?
Okay. So ideally, as per recommendation, Mchat should not be done. There is some ages and stages questionnaire which is still available and that can be done. And that will also pick up the social communication delay. So that is also available. That's also available online. For a 3.5-year-old child also, it will be available. That's one thing. Otherwise, you can note down your observations and refer to the developmental pediatrician.
Okay.
Because since 3.5 is already a late age, we can't delay any further. So you can just know, if you can't do any screening, just note down the points and refer.
But if we try to do the Mchat, though it will not be validated, will it give us some idea that the child is having some issues?
Yeah, I am sure it will definitely give some idea, but because the eye contact will be poor, there will be no finger pointing. So obviously all these things, unless there's have been delayed development, because some kids don't develop these skills early, but by 3.5 years, some of them develop. But there will definitely be some indications which will still be left, like joint tension will still be lacking. They will still have proprioceptive and vestibular issues. So question number 4 and 20. They may have, like question number 4 is about climbing and 20 is about bouncing. They may have some problem in this. So we might still get some indication. The score may be lower than what the actually child is suffering from, but I'm sure you'll still get some indication. Yeah.
Basically, sometimes when we have a severe case, yes, in an older child, Mchat may help us.
Yeah.
But in milder cases, it may actually turn out to be normal.
Yeah.
So that may actually sometimes create a difficulty, because if we tell that everything is okay on Mchat being normal, the child may
We
still
cannot
have
say
a
it's
milder
okay, but
ASD.
Exactly.
if the child is on a little on the, it'll give us some solutions.
But the best, I think
it
important
can be
point
done. It helps, yeah. For the severe child, yes.
Yeah.
It helps.
But the
in
thing is,
guiding
at
the
3.5 years, better is to note down the difficulties the child is facing and refer. Because now the child has moved on. Maybe pre-verbal communication is there and the speech has started, but it's not a to and fro speech. Like the way I said, no, child is talking, but there's no to and fro communication happening. And rest everything is normal. So still we'll have to refer.
There's one question. Any online training is available for autistic children living in small towns? Can they have some online sessions or something?
So I think there is no like a format for the parents. There are caregiver skill training programs through WHO also, which are available. But I think a lot of people like us developmental pediatricians have also been doing online training and taking consultations from outside Delhi. So I think it's all more on a 1:1 basis. But if they want, there is a WHO caregiver skill training program, which is about training the caregivers of parents of children with autism, so that they can also undergo.
Autism and other communication problems also. Yeah.
Dr. Shamvi, is it possible that we train our pediatrician friends, as in the ECD program, who are staying in very far off areas and there is no developmental pediatrician around, how to manage these children? Because they have a constant complaint कि डॉक्टर साहब हमारे यहाँ तो कोई है नहीं यहाँ पे जो इनको थेरेपी करवा सके.
Right, sir. So I'm happy to share right now the chapter had announced the autism consensus guidelines in 2017, and with the huge demand for training for pediatricians and on a little more in depth of these guidelines, the guidelines have been revised now in 2024. And probably very soon we'll be doing some TOTs and workshops for the revised autism guidelines in this year. So they'll be giving more insight from the management point of view and more insight from the more evidence-based practices which have come up now. So this is not like a therapy module, I would say, but it will give a fairer idea about the managing from a pediatrician's perspective. So I think these programs are going to be announced very shortly, because these guidelines we just launched in IIP Ki Baat community ke saath on 2nd of April on the World Autism Awareness Day with Dr. Basav Raja and Dr. Vasant Khalitkar. So I think in coming months, we'll be launching this revised guidelines as TOT and workshops.
Now many therapists have opened clinics. Like they have started providing therapy and treatment to these children. But what is your idea on this? Like,
I think ये सारे developmental pediatricians की दुखती रह गए. So, it is becoming a problem for the patients to find out who is doing what and who is doing right, who is doing wrong. So I think, as Dr. Shambhavi is saying, they should, as a chapter, we should have some guidelines that what should be the and we should collaborate with other RCI and other people, that there should be some consensus and team format where these children are being treated. Everyone is sitting and thinks that he is equally competent. He has to. It's like कि 4 लोग बिठा लो और तुम ये कर लो, तुम वो कर लो, कुछ तो कर लो, बच्चे का कुछ तो therapy हो ही जाएगी, and there'll be little improvement as well. So, but there is no standard protocols and standard guidelines which is getting affected and which is creating a lot of problem. And we developmental pediatricians are facing a lot of problem these days. For example, a child who is getting OT for last 4 years and developing severe behavior problem, because this is not these children has to be treated. They have to be given multidisciplinary in a standard goal oriented, focusing on their levels and everything. So it has to be done under the guidance of a specially development pediatrician. So I think as a chapter there will be something which will come up in near future. Dr. Shambhavi will throw more light on this probably.
Right, ma'am. And I think very rightly said, Dr. Praveen, we all are facing these issues. And the problem is every multidisciplinary profession is very important. There is no doubt about it. But the problem is there is no comprehensive care being provided. Someone is doing this, someone is doing that. Then there is no monitoring ki how much the child has improved. And the family can continue that care for 3-4 years and then suddenly realize ki is aspect pe to kaam hi nahi hua kabhi. So I think that case manager, which probably is a neurodevelopmental pediatrician, is the best person, I would say, is very important for any child or any family who has a child with autism. And unless we kind of promote this within our fraternity, because a lot of times these referrals are given directly by pediatricians to these multidisciplinary professionals, bypassing a role of a developmental pediatrician also. कि आपका बच्चा 2-2.5 साल पे बोल नहीं रहा, सीधा speech therapy करा. So I think that awareness also has to come to our own fraternity and our community. Every person is very important in that team.
And worst thing is, these therapists call themselves as doctors. And I think the government should do something about it. They are not doctors. They are writing doctor very boldly, all occupational therapists. And then many a time the children come to us after 3 to 4 years of isolated speech therapy. And then by the time it becomes too late. So obviously, I think some guidelines have to come, and they writing doctors is one of the, I think it should be controlled or curbed. Parents don't even know. Parents don't even know that they're not doctors.
2.5 years coming with not speaking, they normally refer to the speech therapist. If you go into the details, then you find out this is a case of probably autism. And they start speech therapy also. Like, what is your say?
Basically, most of these centers are doing OT and speech therapy. Autism, we need to address the core deficit. So there's nobody who's working on social and communication aspect. So yes, developmental pediatricians have to be there in the loop, but I think pediatricians also have a very important role to play to keep guiding them again and again to the right person and to keep talking to them about what is happening in the therapy. So if clinically, if the child has autism and they're going only for speech therapy, mostly the speech therapy is doing some oromotor exercises and asking the child to produce sounds and words. And this very frequently leads to a lot of behavioral and emotional issues because the child is being forced to talk. Any human being who's being forced to talk is going to develop a lot of emotional issues. So that becomes a problem in many cases. And
Yes.
many a times they do start speaking words. See, most of these autism children, the milder ones, since their speech area is okay, with little inputs, they start coming up with alphabets and rhymes and numbers very easily. So most of the speech therapists are actually working around those areas and not working on communication. So as the child grows older, it may create problems which are difficult to handle later on because the child has missed the golden years. And over the last few years, we have seen very few children with isolated speech issues. Most of them have associated social communication, play deficits. So overall comprehensive developmental inputs are very important, and isolated speech therapy creates problems in many cases.
Yeah, and then
Ma'am,
speech is the most visible disability. So parents keep on pressurizing us, ma'am, speech therapy kab shuru karoge? Aap ye kyun de rahe ho? And in my center nowadays, I've started seeing that because other centers are not giving, so they'll skip the behavioral intervention class. They'll come for OT till I give speech. So I have to literally sit and counsel them that how important behavioral interventions are. So unless we all join hands in counseling them, they will never understand it. Because other centers are not doing, so why are you doing? They become suspicious against us. Why are they doing behavioral intervention? Why is she not starting speech therapy?
ma'am, in the discussion, there was online tools besides Mchat. Is there any other online tool also available for screening these children?
Ready online tool for autism, only Mchat is available. Otherwise, we can download. There is Trivandrum Development Screening Checklist.
Mhm. So,
Social communication
is there any
checklist.
comment on the use of social communication questionnaire and Trivandrum autism behavioral checklist?
Trivandrum Autism Behavioral Checklist is a longer format. It does give a lot of information. It's a very good checklist, and it does tell us about the severity of autism also. So it can be used. Social communication questionnaire has been found to have a lower sensitivity and specificity compared to Mchat. Mchat has been the most popular, and I think it is the easiest to use. But other tools are also okay. They can be picked up.
There are other tools also which can be used in infancy. There is called CSBS tool is there, which communication scale and for in the infancy, but it is not commonly used, which is difficult to pick up in early ages. So Mchat is generally is the time little can see the signs and symptoms also, and they're ready to accept that. For younger children, they are not accepting also, but it is available and it has been standardized for Indian population also. That is called CSBS test.
Yes.
So that's a good tool. And actually, in high risk cases, like siblings of children with autism, it becomes an important tool to screen them early. We need to do it in the first year of life.
Dr. Puneet, do you have any comments made? Dr. Puneet? Are you there? So, mind of the session. Dr. Niti, please propose the vote
Thank
of
you
thanks.
very much, everyone. It was delight to hear from all the faculty and from everyone. And thanks all the participants for making this webinar so successful. So many participants are there. And thanks, Dr. Ajay, for bringing all of us together. It was a delight, really.
Thank you.
Thank you very much. Thank you all the delegates for joining in.
Thank you. Thank you,
Thank
sir.
you.
I
Welcome,
saw there
welcome.
were 70 delegates at one point of time. That's a huge number.
Yes.
Thank you so much.
Thanks.
Thank you. Thank you,
Thank
Dr.
you very
Ajay, for the
Thank
initiative
you so
and
much.
involving.
Thank
Thank you.
Mr. Sushil, please close the session.
भेजो